Welcome to the Africa Public Health Podcast from Africa CDC, your go-to source for information on key continental health security issues. I am your host, Andisiwe Michelle May. In this series, you will get valuable insights from African scientists and researchers as we unpack important public health topics that impact the continent and the latest developments in public health research. Today, we dive into the crucial topic of genomic surveillance and pathogen tracking, featuring insights from one of the leading scientists on the continent.
My name is Sofonias Tessema. I work as a program lead for Pathogen Genomics at the Africa CDC.
Dr. Tessema hails from Ethiopia, where he first encountered the challenges posed by the battle against malaria. His early exposure to the disease sparked a deep curiosity about infectious diseases and motivated him to pursue a career in pathogen genomics.
I grew up in Ethiopia, where malaria has been a big challenge, and it's still a big challenge. And I've always wanted to study infectious diseases because of the curiosities that I had about malaria, asking questions about why it's killing people, how it's making people sick, and how we can prevent it. And later, I had the opportunity to study the genetic makeup of malaria, the genomics of malaria, also trying to study how we can come up with preventive measures such as vaccines and markers that can help to prevent malaria and also control and elimination of malaria in the African continent. I studied in Australia, did my PhD, went to the US for a postdoc, but later when there was an opportunity to come back to Africa CDC, I came back, and since then I've been working at the Africa CDC to establish the program for genomics and later to expand it further and in ensuring access to new and innovative technologies in our effort to control and eliminate infectious diseases in Africa.
Dr. Tessema, I'd like to kick off our conversation with a bit of context. How many outbreaks does Africa face yearly?
The Africa CDC records the number of reported outbreaks across the continent, and it's currently estimated at more than 160 outbreaks every year. But these are the outbreaks that are detected and that are reported by countries. But there are also outbreaks that are not detected, that are not reported. So the number will be more than the 160 that we estimate because of outbreaks usually arise in rural settings, in the communities. There is a big chance that these outbreaks can be missed if the surveillance system is very weak. Based on the reports, the incomplete reports that we get, the number of outbreaks is estimated at around 160. That's a large number. In average, if you look at it, that's more than 2-3 outbreaks per week from different countries in Africa. So these outbreaks, some of them are emerging, newer outbreaks. Others are re-emerging outbreaks that we know, and they are re-emerging again as the environment and the climate and other changes that are enabling these outbreaks to emerge and expand in the continent and spread across different countries.
And how is genomic technology revolutionizing the ability to track disease outbreaks, especially with the context you've just provided? Maybe you can give us an overview of the tools and technologies that exist and what their purpose is.
One of the tools in our toolkit for outbreak detection is genomics. And genomics does detect outbreaks of known and unknown origin. What it does is it reads through the genetic material of a pathogen or a disease-causing microorganism, and it provides that complete information about what pathogen it is, what kind of genetic makeup that the pathogen has, and it will also give us information on how we can better detect it and how we can better design countermeasures such as vaccines and drugs on the pathogens. So it's an innovative and probably the best technology that we have for the detection and characterization of disease outbreaks. Its use in Africa is also very critical because we have a mix of outbreaks of human origin, we have outbreaks of zoonotic and animal origin, we have outbreaks of environmental origin. For all these outbreaks, we may not have the diagnostic tests or the testing kits, the detection kits that are already designed and available. A very good example, we can take the COVID-19 outbreak. In China, the COVID-19 outbreak was detected using genomic technologies. For the first time, the cause of those respiratory diseases is known as a virus by using genomic technology. So whether the disease is known or unknown, a genomic technology can actually be able to detect it. It can give us a complete genetic material, complete genetic information, and that complete genetic information can be used to design countermeasures, to design response strategies. Another example in Africa, we can take Ebola. The Ebola outbreaks that we experience in DR Congo or in Uganda, for example, in the past 2 years, we had outbreaks in Congo and in Uganda.
An outbreak of Ebola has been declared in Uganda, the Health Ministry and World Health Organization have said.
The differences between these viruses are in their genetic composition. When you are doing your PCR, there are differences. You may need a different PCR for Ebola Zaire and a different PCR for Ebola Congo.
But those two outbreaks were not identical. One is caused by one strain, another is caused by another strain. So the difference in the genetic makeup of these Ebola outbreaks can only be detected using molecular and genomic technologies. So the technology is an enabler. It provides information beyond just knowing whether there is a pathogen or not. It gives us the detailed information about a pathogen. And that detailed information can help us to carefully design our response measures. So that's what the technology does in the outbreak response, in the outbreak detection space, especially for Africa. It's a very critical technology.
You mentioned the COVID-19 pandemic, and just to jump on that, I'm curious to know, prior to the pandemic, where did we stand with surveillance capacity in public health care on the continent? Was it worrisome, or were we on a good track?
At the Africa CDC, we started the genomics program just 1 year after Africa CDC was established. This shows you that Africa CDC was open to adopt new and innovative technologies and leapfrog the outbreak detection and testing capacities in the African continent. So in 2018 and 2019, we conducted a continental assessment. We looked at in which countries do we have these capabilities? What are the bottlenecks? What are the barriers in our access to this technology? Because the first thing that Africa CDC wanted to address is access to the technology. And we've done a continental assessment by visiting labs, by getting data from different sources. What we found was very shocking. Only 7 out of the 55 countries had the capabilities to be able to run genomics and sequencing in their laboratory. The rest of the countries didn't have access to that technology, and the technology was far reachable to many public health labs. And then we also assessed beyond, having the technology, having access to the technology, what are the barriers? We've looked at availability of trained personnel. We've looked at availability of the supply chain process. We've looked at the data analytics and data capacity, and then also the integration of the technology into the existing systems. We had significant gap across the space, across the spectrum in the utility of this technology. For the past few years, Africa CDC has been trying to address all these gaps, but it is informed by the initial assessment that we've conducted and we've identified across Africa. So in terms of the availability of the technology, it's not only availability or access, but it is the use of the technology to detect outbreaks, to use the technology for our disease surveillance programs. What we've seen in the past few years is a rapid expansion in that capability.
Are we seeing an increase in more and more countries having access to that technology? And how has this impacted disease control efforts?
After identifying the gaps that I mentioned, whether it's in access, workforce, data, trainings, Africa CDC identified that we cannot address this problem alone. and we created a partnership, a public-private partnership, what we call the African Pathogen Genomics Initiative. So the African Pathogen Genomics Initiative was an effort from different partners. We have stakeholders in the private sectors. We have stakeholders from the public sector, philanthropic sector. All of us came together and identified what are the key priority areas that we would like to address in order to make sure that this needed technology is accessible, available to the public health institutions in the African continent. So the partnership was launched in November of 2020. And in the past 4 years, the partnership has been working on expanding access, training the workforce, ensuring that genomics data is generated in a timely manner, and then also using that data to inform our decision making. So far, we've made a huge progress. I think I can say the partnership distributed the largest number of sequencing equipments across the continent. And today, from 7 in 2019 to about 40 countries have this capability. So this is almost a 6-fold increase in the number of countries that have sequencing technology in their laboratories, genomic technologies in their laboratories that can be used to detect outbreaks, that can be used to strengthen our surveillance system. Not only just making the equipment available or the technology available to countries, we have trained almost 1,000 experts in running the machines, running the assays, analyzing the data, interpreting the data, and then also reporting the results. So these capabilities have been built in response to the COVID-19 pandemic, which helped to accelerate the effort of the partnership. But on the way, we've also seen that this technology has been used in support of different outbreaks that we have in the continent. A good example, a capacity that was built for COVID now is helping for Ebola, in response to our Ebola outbreak. And most recently, this technology has been used in response to the cholera outbreaks in Southern Africa and the monkeypox outbreak that we are seeing in the continent. So the technology is pathogen agnostic. Even if it is built for one pathogen, it can actually be helpful and can support the detection and characterization of different outbreaks. So it was built and accelerated as part of the COVID response, but over time, we're seeing the testing capacity is expanding beyond COVID and now supporting different disease areas, different priority disease areas. We also have a continental program to expand cholera genomics capability. This is because in recent years we are seeing an expanded and sustained cholera outbreak in Africa, and we're trying to characterize what are the causes of this cholera outbreak, how it's spreading between countries, between regions, and trying to come up with a recommendation for better control and better management of cholera in Africa. We have also programs that are running to expand genomics for antimicrobial resistance. Again, antimicrobial resistance is described as one of the silent pandemics, and the best technology that we have to characterize antimicrobial resistance is genomics, because we can see the genetic characteristics of the bacteria, and we can classify the bacteria as resistant or sensitive to the drugs. So we're using this technology again in support of expanding AMR surveillance in the continent. The whole idea of the initiative was to address the core gaps. The African Pathogen Genomics Initiative addressed gaps around access, gaps around workforce development. That's still, it still remains a gap. As we expand the technology, we need more and more advanced trainings. We need more and more translational trainings. We have also been trying to address the challenge associated with data analysis and data reporting. However, there is a long way to go in integrating this technology into the existing system. In 2023, we launched the second version of the initiative, what we call the Africa PGI 2.0. This initiative is now trying to integrate the technology into the existing system, and then also strengthening the ecosystem for genomic surveillance in Africa.
What is the importance of pulling data that decodes diseases? And how essential is it that role players in the health space in Africa are able to generate and share critical data in time to inform public health decisions?
There are two important factors, I think, time and quality. At what time that the test is conducted, the available information is analyzed, and that information, that data needs to be of good quality because it's informing a decision making. So the decision making has to be informed by good quality data. So the time that it takes from receiving the samples to processing it and to analyzing it and reporting it has to be really minimized. It's a work in progress because there are different factors that can affect turnaround time in a laboratory. Access to the samples, how long it takes to process it, availability of the necessary and the critical supplies and reagents in the lab, availability of well-trained workforce within the lab. All of these factors can affect the turnaround time. Once the data is generated, once the report is available, it has to be shared with the necessary interpretation to either National Ministry of Health so that this data can actually inform the control program or the response program. It also needs to be shared with public health institutions like the Africa CDC, the World Health Organization, and then also global bodies. I think we've learned a very good lesson during the COVID-19 pandemic. The speed at which the data is shared is very determinant in our control, in our response, in our mitigation plans for any outbreak. So we are encouraging and we are training, we are providing the necessary infrastructure to improve the time and quality of data that comes out of the labs, and then also improving the data sharing process, because data sharing is not only technical, but there are also governance issues, the implication of the data sharing. We've been engaging with our member states to think through what is the best mechanism in enabling data sharing, because sometimes there are consequences, unwanted consequences of data sharing that we've seen in the past. How do we prevent it? But at the same time, the African continent continues to be a leader when it comes to data sharing, whether it's monkeypox, a new clade of monkeypox, or whether it's Ebola sequences. The countries, our member states, are sharing it as quickly as possible. We've recorded 24 to 48 hours turnaround time in sharing Ebola sequence data from the Democratic Republic of Congo. So we are seeing, our researchers, our institutions, our member states are committed in sharing data, but they also need to be protected from the unwanted consequence of this data.
We know that collaboration is a key element of this work, be it with other organizations, governments, or funders. So how important has it been with the work you're doing? And I think it would be great to highlight the role that community healthcare centers play on the ground level for implementing some of these amazing initiatives.
Genomics, surveillance, genomics, this is a new technology that has been introduced to the African continent. And we know there is a disparity in capacity. We know there's disparity in well-trained workforce, availability of well-trained workforce between different countries. Some countries have well-equipped laboratories. Other countries are in the beginning. Others are still trying to build this capacity. And we knew that we need to leverage on the existing capabilities in the continent. We established a continental network. This continental network is bringing academic, research, public health institutions across Africa, both from the human and also to some extent from the animal health sector, trying to bring them and collaborate. If a country has no capacity, but if another country, another laboratory has that capacity just across the border, so we've been facilitating that process to send the specimen from one country to the other, and then the other country with the capacity can provide the service for those countries that do not have this capability. This is actually a networked approach that we've been implementing. And the benefit of the network is, one, creating access for everyone. Any country, whether they have the capacity in the border or not, they should have access to this technology. So we've created that access mechanism through a continental collaboration scheme. The second one is we have gaps in human resources. So we have to leverage on institutions that have the capacity to be able to conduct the training. Basically, we are leveraging on existing academic and research institutions to be able to provide the trainings for those who are just establishing the capacity. By nature, the technology requires collaboration. It requires multi-sectoral approach because it is pathogen agnostic. It can work for animal pathogen, it can work for human pathogen, it can work for any pathogen from the environment. So collaboration between different sectors is critical. The second part is this method, the genomics method, actually generates large amount of data. So it requires data analytics capacity. It requires capabilities to analyze data. So some institutions have better data analytic capacity than others. There's disparity in that, in the data analysis capabilities, availability of data scientists and bioinformaticians in the countries. It's very different between different countries. So one approach that we've implemented during COVID, and now we are doing it at the moment, is collaborative analysis. If different countries come together, share their data, analyze it together, then interpret it together and come up with a report that can inform decision making is critical. We've done that in collaboration with academic and research institution, where we were able to bring more than 50 countries together to analyze their data and report the findings from the data. Now we are doing the same thing for cholera. We have 7 countries that are doing collaboratively analyzing their data. One country may have better capacity, others may not have the capacity that they need, but we're bringing them together to collaborate, to work together, and then also get the necessary technical support to be able to analyze the data and interpret the data, make it available as an information that can be used for decision making. So collaborative is not an option. Collaboration is a must for a successful genomics program, and we are taking that as one of the key enablers for the Africa CDC's vision in expanding genomics in the African continent.
Can you tell us a bit about Africa CDC's vision? Maybe touch on some things that are being implemented to make this vision come to fruition.
I think looking ahead, we have made significant progress as a continent in expanding access to genomics, but we still have countries that do not have the capacity in their border. Africa CDC has a vision to reach to all countries to establish genomics capacity within their borders, within their national reference laboratories, in support of enhanced outbreak detection and disease surveillance. So we are working towards that goal to make sure that every country has the capacity and not to leave anyone behind. So that's a commitment of Africa CDC. We've been working on that, and we think we'll achieve that by 2025. The second area that we are looking into is identifying and prioritizing pathogens. Sequencing and genomic surveillance is expensive. It costs more than any other diagnostic test that we have. Because it's expensive, we need to prioritize. Where do we need to apply it? For which pathogens? In which countries? We are working with expansion of this technology in the African continent. We needed to carefully look at what are the priority areas where we need to apply it. We've been working with experts from the continent, across the continent. They've been helping us to come up with priority list of pathogens. For example, antimicrobial resistance, malaria drug resistance, or if it is cholera from the foodborne pathogens, or vaccine preventable diseases. Because we have several outbreaks, genomics may not be applicable to all of them, but identifying the right pathogens where we can see a good return on investment is very important. So we have identified priority pathogens for genomic applications. Saying that using genomics only for surveillance may not be the best decision for the African continent. We have several outbreaks. We need to use this innovative technology. We need to leapfrog our outbreak detection and disease surveillance systems. So in order to do that, we need to have people well trained in translating genomics for public health. This translational genomic training is very critical. It's not only just to generate the data and report it, but how can we use our workforce to start thinking about and coming up with the design of new diagnostics, the design of new vaccines, at least informing the vaccine designs, and the design of new interventions. So these translational genomics trainings are also critical. That is where the future is going to be in expanding the continental capacity in translating genomic data into products such as diagnostics, vaccines, and therapeutics. While we're trying to achieve this, there are challenges that we still haven't yet addressed. For example, supply chain is a big challenge. One of the major challenges that we are facing is timely access to the supplies and reagents for genomics and for sequencing. So we are working with different partners, several partners, member states, trying to address the challenge that we have on supply chain and logistics. The private sector is also engaged in addressing this challenge. Hopefully, as we move forward and looking ahead, the supply chain will be a major agenda and a major factor that needs to be addressed to promote genomics in Africa. Africa CDC has been conducting different trainings to skill up the experts in member states, but there are also different partners that are expanding the trainings. But there is a need to move from these short-term trainings to a more long-term trainings. So universities, academic institutions need to take this up and start training people in undergraduate, master's and PhD programs, or even beyond that, like postdoctoral programs, to build the next generation genomics and bioinformatics experts, because we have a critical gap in that space. Looking ahead, another opportunity is also how do we leverage artificial intelligence in genomics and in outbreak detection. There are several opportunities and promises of artificial intelligence, but we need to address the bottlenecks, the infrastructural gaps, the internet connectivity challenge, the workforce, and then also the ethics and social and ethical implications of using AI in outbreak detections. The intersection between AI and genomics is something that we are very excited about. It's an area where we think it can help us achieve the visions of Africa CDC.
I'm glad you touched on some opportunities and challenges of artificial intelligence. And with those in mind, have there been any other areas for innovation that you have identified?
We are looking into from a very simple applications of AI, for example, in building AI-enabled chatbots. Most laboratories are beginners. So a beginner, a newly trained person may have a lot of questions. So if there are AI-enabled chatbots that can provide support, answer questions quickly and efficiently, I think that could be a very good starting point. We're looking into AI, for example, for continuous learning, improving the workforce, because one of the critical gaps, as I said earlier, is having well-trained personnel, and the technology is also evolving. So we need to have that continuous learning programs. We think AI can revolutionize that. And then other areas where we see is prediction. Genomics can not only just help to detect, but it can also help us to predict and forecast outbreaks. So if there are proper models, of course, with carefully addressing the ethical and social implications, AI can also help us predict, and that prediction can actually help, in preventing outbreaks. For example, if we can predict cholera outbreak for next year, we can put in place, the necessary measures now. Those are areas where we are looking at the promise of AI. In more complex way, it can have lots of different applications, but we are looking into, what are the most feasible applications at this stage, being very pragmatic about the reality that we have in the continent. But saying all of this, one thing that I would like to mention is all this effort can only be successful and can only be sustained if it is supported by the necessary policy strategic framework at a country level. So countries need to adapt it. So we are also working very closely with countries to develop national strategies for genomics, national policies for genomics using a One Health approach. We think the sustainability of all of this is dependent on countries establishing the necessary systems, then the necessary support, and integrating it with their existing surveillance system at a country level. Then that can help us to bring everyone together with a very clear strategy, with a very clear policy.
Thank you, Dr. Tessema, for such an insightful conversation. It's exciting to hear what the future holds, and knowing that we have excellent people such as yourself who are contributing a hand in making that happen. Do you have any last words that you'd like to share?
I would like to use this opportunity to thank all our partners, all our member states, academic and research institutions across Africa that have been supporting Africa CDC, working with Africa CDC with this big challenge. We've made progress together. There is a long way to go, and we look forward to further strengthen our partnerships and make sure that we achieve the vision that we set as a continent.
Thank you to Dr. Sofonias Tessema for joining us on this episode. Whether you're an expert in the field of public health or simply interested in learning more, the Africa Public Health Podcast is here to serve as a reliable resource for you. Please get in touch at africacdc.org. Until next time, I'm Andisiwe Michelle May. This is a Volume Podcasts production.